Today I'm going to talk about the first phase out of my 4 phases approach to fixing knee pain. Hi, I'm Alex Effer, founder of Resilient Training and Rehab, and I've helped thousands of coaches and practitioners from around the world get faster and more consistent results with their clients. Let's get into it. So as I mentioned, I've got 4 different phases to improving knee pain, and that's because knee pain goes across the spectrum. It is also important to understand that there are different approaches that we can take at improving knee pain. We need to increase the load, but more specifically, first of all, we need to reinforce the mechanics of the body. If you want to understand the 4-phase approach, check out my knee course. The link is below. We talk in depth about the different phases that I approach it, exercises that are associated to them, and again, how to understand these mechanics a little bit deeper. So for this first phase, we're going to be talking about the biomechanics. The first thing we have to do is teach the bones and teach the joints how to move effectively so we're able to distribute force a little bit more effectively. Because if our joints aren't in the right position, then the muscles can't react, the muscles can't work properly, and the tendons become overloaded. Even the muscles become overloaded. So it's important to restore the joint mechanics first before we introduce a little bit of load to it. So just a little bit of a recap. I've talked a little bit about this in previous videos, but let's just a little bit of recap. In order for the knee to bend effectively, the tibia has to turn inwards without the knee coming in. So I want the tibia to go in as the femur stays where it is. So it's going to relatively externally rotate. That's how knee flexion happens. That is going to be associated with your ability to internally rotate the hip. So hip internal rotation and tibia internal rotation lead to knee flexion. Why knee flexion is important is because that sets up the muscles to be able to distribute force effectively, be able to accept force, absorb force. If my leg straightens, which is the opposite where the tibia turns out and the femur turns out, it externally rotates, then I'm going to be hitting the ground with a locked knee. So now patellar tendon gets overloaded, I get the inside or the outside of my knee gets overloaded, even certain muscles become overused and overloaded as well. And so it's important that we make sure the pelvis is in a position to be able to accept the force, to allow the femur to internally rotate, to allow the tibia to internally rotate, so the muscles can distribute force more effectively. So we're going to talk about 3 different exercises that are going to restore these mechanics in different ways. So the first exercise we're going to do is we're going to target the tibia directly. And I like using this foam roller because what I'm going to do is I'm going to force that tibia to internally rotate with a little bit of external pressure. So I like to call this the tibial smash. And I include this again in a lot of my programs just because I think it's so effective in restoring proper knee mechanics in a very easy way before I integrate it with the foot and the hip. So what I'm going to do is I'm going to take the foam roller and I'm going to put it on the pointy part of my knee. I'm going to take this foot and I'm going to bring it away from my body. So instead of it being underneath my body, I'm going to bring it away from my body. Because now what happens is this is going to put my leg into an externally rotated position or turn it out. But if I lean into it, especially if I rotate my body towards the inside, now this foam roller is pushing up and it's turning the tibia in internal rotation. So I'll grab my lower part of my ankle and I'll turn in just to further that internal rotation. And then I'm just going to rock side to side. As I rotate in, I'm going to get more tibial internal rotation, and I'm just going to go back and forth. If I go on the outside, I get to open up my hip a little bit, which opens up the posterior capsule, which is very important for for femur internal rotation. So I'm just going to rock back and forth, and I get people to do this for about 30 seconds, maybe 2 sets of 30 seconds, just to get the tibia, or teach the tibia how to internally rotate before I integrate it with other structures. So the second exercise I'm going to do is called Sidelying hip shifts. Now what I'm going to do just to further the internal rotation is I'm going to bring this right foot up a little bit. So you can see that the leg is kind of going into the foam roller now. That's just going to further reinforce the internal rotation of my hip and of my shin. So how I'm going to do this is I'm going to push both feet into the wall gently so I'm not pushing myself away from the wall, because I want my knees and hips to be around 90 degrees of knee flexion and hip flexion. I'm going to push on the inside edges of my feet. I'm then going to push the right knee down into the foam roller. And then what I'm going to do is as I breathe in, I'm going to pull the knee back towards me, so roll the foam roller towards me. As I breathe out, I'm going to roll the foam roller away from me. And so my knee is going to go behind, my right knee is going to go behind my left knee, then it's going to go in front of my left knee. And I want to do it without my hips rolling back and forth. I want to keep my hips stable, so it's just coming through the femur. So it's a very small movement. If I do it too much, you can see how I'm rotating away. I want to make sure that my shoulders are stacked and my hips are stacked. And it's a very slow movement. You should feel your groin working. You'll feel a little bit of that glute working, which is going to be a little bit more the glute medius. As long as we keep the pressure into the wall and we don't lose it, we're going to get that hip working. So I'm just going to shift back and forth. I like to do about 10 to 15 reps, nice and slow. Think about 3 seconds forward, 3 seconds back, just to make sure that I'm not rolling excessively and I can keep the pressure in my hips and get the motion I'm looking for. This is going to be the cable hinge, one of my favorite ways to reintroduce hinging for people who struggle with it, but it's also going to keep the weight in your hip to really force that internal rotation of the hip and the tibia. Because what it's going to do is the cable is going to pull me towards it, so everything is going to want to turn out. So I have to turn everything in just to resist it. So this is going to be a kickstand position, which just means I'm going to have this back leg on my toes. I like to keep less weight on this back leg, really emphasize the front leg. I'm going to keep the arm across my body. This is not a super heavy weight. If it's really heavy, it's really going to push and I may have to compensate to overcome it. So I think this is maybe like 20, 25 pounds. Just to get into it, we could always increase the weight after. But what you're going to think about doing is pushing the knee towards your toes. You're going to keep the weight in your heel. You're going to let the cable pull you across the body. As you bend over, you're going to let the cable win. It's going to pull you towards the cable. Then you're going to come up. As you come up, drive the knee forward. I don't want you to come up and slam the knee back. I want you to keep the arm across your body as you drive that knee forward. It's going to keep all the weight in the glute. Okay? You do about 2 sets of about 8 reps, nice and slow. Think of 3 seconds down, 3 seconds up. And if you keep that knee bent, you're going to feel a lot of glute working. So when we're looking at the knee, it's really important to understand that restoring the mechanics at the knee, at the hip, even at the foot are going to be super important for teaching the knee how to be able to absorb force a little bit more effectively. If you enjoyed this content and want more like it, don't forget to like and subscribe, and I'll see you next time.